A lot of the pain in the front of the hip or the front of the ball and socket of the upper portion of your thigh, a lot of times that's what I see is related to arthritis of the hip, which is groin pain. On the outside part of the hip, which is the side that you lay on when you sleep on your side, a lot of times that's bursitis. Not every time. Bursitis is inflammation of a soft tissue sac that's supposed to lubricate a tendon on the outside of your bone of your femur. Other people complain of pain in the buttock area. They call that the hip. That could be a variety of causes. It could be sciatica, which is related to pinched nerves. It could be sacroiliac disease. It could be referred pain from their spine, whether it be their facet joints or their lumbar discs. That's a variety of different causes. That's one of the things that we could explore at the same time to try and rule out other causes of what we think is hip arthritis. What is the best way to relieve hip pain? Relief of hip pain has to be tied to what the cause of the hip pain is. Certain things are minor, such as bursitis and inflammation. That's not related to structural changes like arthritis. Those patients usually get better with sometimes a course of anti-inflammatories, a steroid shot, or modification activities or physical therapy. But when the arthritis becomes a major factor, then sometimes the lack of ability to have options to proceed forward with their lifestyle leads them to consider things like surgery if everything else fails. So that's where we come in as orthopedic surgeons. When do I need a hip replacement? And that's a very personal decision because I don't volunteer surgery for anybody. The goal is function. Everybody's tolerance for loss of function is different. When you're a youngster and 20 years old, 25 years old, you can run maybe a 7-minute mile. You could probably jump a couple feet in the air. You do a lot of different things. As you get older, your activity to be able to do that goes down. But when it starts really getting into the way of independence and to be able to do things that they find unacceptable, they make a balance sheet. These are the things that are non-negotiable in terms of what I want to do. Then the only thing left sometimes when you run out of the conservative treatments such as injections or anti-inflammatories or behavior modification is surgery. So that decision is usually made by the surgeons and the patient together, not just the surgeon telling me, hey, you need a hip replacement. What's reasonable from a hip replacement is probably unrestricted weight bearing, allow you to progress and put full weight on it as much as you like with the assistance of a device such as a walker or a cane. I would say half of the patients between 2 and 3 weeks discontinues the use of ambulatory support. It can walk independently. And of course, that's dependent on your age, your BMI, and what your function level was. But in general, by 6 to 8 weeks, most people have seen me in the office a second time and have recovered. Probably about 80-90% are talking about when they can do things again, like hike and play tennis.